Move. Paramedics rushed in, pushing a stretcher carrying an unconscious girl in a red dress. But before doctors could reach her, a massive military canine suddenly jumped onto the stretcher. The dog planted its paws over the girl's chest and started barking violently at everyone in the room. "Get that dog off her," a doctor shouted. 2 security officers tried grabbing the leash. The canine snapped. Nobody could get near the patient. The girl's heart monitor started dropping. "Sedate the dog," someone yelled. Then the rookie nurse stepped forward, blonde, calm. She looked straight at the canine and said 4 quiet words, a military code. The dog immediately stopped barking, sat down, and the only Marine in the room suddenly realized something strange. Because that command hasn't been used since the Afghan War. Before we begin, subscribe and drop where you're watching from in the comments. This story starts with a military canine that wouldn't let anyone near a critical patient until a rookie nurse said something nobody in that room had any business knowing. Camp Pendleton's emergency department wasn't quiet that afternoon, but it was predictable. Fluorescent lights hummed overhead. Monitors beeped steadily. Nurses moved between trauma bays with the rhythm that only comes from long hours in controlled chaos. Ava stood near the nurse's station updating a patient chart, her blonde hair tied back neatly, blue scrubs slightly wrinkled from a long shift. 6 weeks into the job, she was still the rookie. People liked her well enough, but nobody trusted her instincts. Yet, Dr. Caldwell had reminded her more than once that observation mattered more than action when you were new. Ava never argued. She just listened and kept noticing things others didn't. That quiet habit had followed her long before Mercy General hired her. It was the same habit that had kept wounded Marines alive in dusty Afghan valleys years earlier. But nobody here knew that. To them, she was simply the calm blonde nurse who spoke little and worked hard. The ER doors suddenly slammed open so violently that several nurses looked up at once. "Move! Move!" a paramedic shouted as a stretcher burst through the hallway. 2 medics pushed fast, their boots squeaking against the floor. And on the stretcher lay an unconscious girl in a red dress that looked painfully out of place inside a military hospital. A medic shouted vitals while running. Female, 18, sudden collapse, no prior condition, heart rate unstable. Behind the stretcher, a thick leash dragged across the floor. Ava's eyes moved instantly to the other presence rushing into the room. A massive military canine, jet black, muscles tight under its coat, charged alongside the stretcher with focused intensity. The girl's head rolled slightly with the movement, her pale face slack with unconsciousness. One nurse whispered, "That's General Carter's daughter." The words traveled through the room like electricity. Everyone in the building knew the name. Doctors surrounded the stretcher as it slid into Trauma Bay 3. "Let's move. Get vitals. Oxygen. Cardiac monitor." Caldwell barked as he stepped in. A nurse reached toward the girl's arm to secure and fall line. That's when the canine exploded into motion. With a powerful leap, the dog landed directly on the stretcher, planting its front paws across the girl's chest as if claiming the space. A thunderous bark shook the entire trauma bay. Nurses jumped backward. The dog's teeth flashed as it swung its head toward anyone who moved too close. "Get that dog off her!" Caldwell shouted. 2 security officers rushed forward to grab the leash. The canine spun with terrifying speed, snapping its jaws inches from one officer's arm. The officer jerked back instantly. Nobody dared step forward again. The dog stood rigid over the unconscious girl, barking at anyone who approached like a soldier guarding a fallen comrade. A monitor began to beep faster beside the bed. Her heart rate was dropping. Chaos rippled across the room. A respiratory tech whispered nervously, "We can't treat her like this." Caldwell rubbed his forehead once, frustrated. "Sedate the dog," someone suggested from behind the monitors. But the idea stalled immediately. If they sedated the dog and it collapsed onto the girl, it might crush her chest. The canine barked again, louder, the sound echoing off the metal cabinets and tile walls. The girl's pulse dipped on the monitor again, the numbers blinking and warning red. A nurse whispered, "She's crashing." Every second without treatment made the situation worse. Yet, nobody could move past the animal standing guard like a trained sentry. Ava stood quietly near the doorway, watching everything unfold. The room felt tense and noisy, but her focus locked on the dog. It wasn't attacking. It wasn't panicking. It was protecting. She stepped forward slowly. "Don't," Caldwell said sharply without looking at her. "Nurse, stay back." But Ava kept walking. Not fast, not hesitant either. Just steady. The canine's head turned toward her instantly, ears stiff, body braced. Everyone expected the dog to lunge. Instead, Ava stopped 2 feet from the stretcher and crouched slightly so her eyes were level with the dog's. She studied the animal for one long moment. In that moment, she noticed something nobody else had seen. The dog stance wasn't defensive aggression. It was casualty protection posture. The same posture military K-9 teams used in Afghanistan. When a handler went down in the field, Ava felt an old memory flicker across her mind. Dust, helicopters, a wounded Marine bleeding into the sand while a K-9 stood guard. She hadn't thought about that day in years. The dog barked again, louder this time. Ava spoke 4 quiet words. Guardian protocol. Stand down. The effect was immediate. The barking stopped as if someone had flipped a switch. The massive dog stepped backward from the girl's chest and sat down beside the stretcher. Just like that, the trauma bay fell completely silent. The only sound left was the steady beeping of the heart monitor. No one moved. 2 Marines standing near the doorway stared at Ava with wide eyes. One of them muttered under his breath. That command, he looked toward the dog again, stunned. They stopped using that after Afghanistan. Every pair of eyes in the room slowly turned toward Ava. Caldwell looked at her like he was seeing her for the first time. "Nurse," he said slowly. "Where did you learn that command?" Ava didn't answer immediately. Instead, she reached for the forekit resting on the tray, snapped on a pair of gloves, and calmly began preparing the needle like nothing unusual had just happened. The canine remained seated beside the stretcher, watching her carefully but no longer threatening anyone in the room. Ava glanced briefly at the girl's face before speaking. "Old training," she said quietly. Behind her, the monitor suddenly gave a sharp warning beep, and the numbers on the screen dropped again. The warning tone from the monitor cut through the stunned silence like a blade. The green line dipped again, slower this time, dragging everyone in the room back to the reality they had almost forgotten while staring at the dog. Emily Carter was still in danger. Dr. Caldwell snapped back into motion first. "For line now," he barked, and the team moved in around the stretcher. Ava slid the needle into Emily's arm with steady precision, securing the line while another nurse attached oxygen. The K-9 remained seated beside the bed. Its large frame tense but controlled. Dark eyes tracking every movement in the room. It didn't bark again. It didn't growl. It simply watched. And somehow that made the entire trauma bay feel even more tense than before. A dog trained for combat situations didn't suddenly become calm without a reason. Ava noticed the way its ears shifted every few seconds, scanning the room like it was still evaluating threats. BP dropping, a nurse said quietly from the monitor. Caldwell frowned as he leaned closer to check Emily's pupils. No trauma injuries, no obvious bleeding. His voice carried the confusion of a doctor facing a puzzle that refused to behave like a normal medical case. Emily's red dress had been cut open by trauma scissors, revealing no wounds beneath. Her breathing was shallow but steady under the oxygen mask. Yet the monitor kept flashing irregular heart rhythms. A Marine medic standing near the doorway spoke up cautiously. "Sir, that's General Carter's daughter." Caldwell didn't need the reminder. The tension of that reality hung over every person in the room. Treating any emergency patient carried pressure. But this was different. This was the daughter of one of the highest-ranking Marine generals on the West Coast. If something went wrong here, it wouldn't stay inside hospital walls. Ava stood beside the stretcher, checking Emily's pulse again. Something about the symptoms didn't sit right with her. The numbers on the monitor told one story, but Emily's body language told another. Her skin tone was slightly pale. Yes, but not in the pattern of cardiac collapse. Ava leaned down closer to check her pupils again. This time, noticing the faint twitch of muscles near the girl's jaw, a detail small enough that most people in the room overlooked it completely. Ava's eyes shifted briefly toward the K-9. The dog had moved its head slightly toward the four-bag hanging beside the bed, not barking, just staring, the kind of intense stare that trained animals used when signaling something important to their handler. Ava followed the dog's gaze, her brow tightened for a moment. Behind her, Caldwell crossed his arms while watching the monitors. "We need labs, toxicology panel, full cardiac workup," he said. A nurse hurried off to prepare the tests. One of the Marines stepped closer to the bed, clearly still unsettled by the earlier moment. He said quietly to Ava. "That command you used, Where'd you hear it? Ava didn't look up from Emily's pulse check. Afghanistan, she replied simply. The Marine blinked, surprised by how casually she said it. The room shifted slightly after that word. Afghanistan wasn't a place most civilian nurses referenced casually. Caldwell looked back toward her again, curiosity flickering behind his professional calm. But the doctor didn't press further. Right now, saving the patient mattered more than solving the mystery of the rookie nurse. Outside the trauma bay doors, things were already escalating. Military police had arrived within minutes after hearing who the patient was. A pair of uniformed officers moved through the ER hallway, speaking urgently into radios. Word traveled quickly across a military base, especially when the last name Carter appeared in the report. Meanwhile, outside the hospital building, something else had begun forming. Satellite vans, news trucks, reporters gathering with microphones and cameras, sensing a story before anyone had confirmed details. One reporter was already speaking live into a camera near the hospital entrance. We are receiving reports that the daughter of Marine General Robert Carter has been rushed into emergency care here at Camp Pendleton Medical Facility. The broadcast rolled across local stations within minutes. Inside the ER, Emily suddenly stirred. A faint gasp escaped from beneath the oxygen mask, and her eyelids fluttered open for a brief moment. Ava leaned closer instantly. Emily, can you hear me? The girl's eyes struggled to focus, but they eventually landed on the large black dog sitting beside the stretcher. Titan, she whispered weakly. The canine's ears lifted instantly at the sound of its name. Its tail thumped once against the floor, but it didn't move from its position. Ava gently touched the girl's shoulder. Emily, stay with me. Do you know what happened? Emily's breathing hitched slightly. Dad told Titan, never leave me, she murmured faintly. Ava nodded gently. He's doing a good job. The girl's gaze drifted slightly toward the ceiling lights, her expression briefly confused. Then she whispered something softer, something almost lost under the oxygen mask. Something smelled strange. Her eyes closed again before Ava could ask another question. The monitor beeped sharply as Emily slipped back into unconsciousness. Ava stood upright slowly, thinking through what she had just heard. Something smelled strange. Her mind moved back through the symptoms. Muscle twitching, unstable vitals, sudden collapse without trauma. Her eyes shifted toward the forebag again, and the dog stare hadn't moved from that exact spot. The canine suddenly stood up from its seated position, letting out one sharp bark that echoed through the room. Every head turned toward the animal again. The dog took a step closer to the forestand and barked again, louder this time. Ava's eyes widened slightly. Stop the four, she said sharply. The room froze for half a second before Caldwell turned toward her. What? He asked, confused. Ava pointed directly at the four line. Stop it now. For a moment, nobody moved. The order hung in the air like something that didn't belong there. Dr. Caldwell looked from Ava to the forebag, then back again, clearly trying to understand why a rookie nurse had just interrupted a treatment protocol in the middle of a critical case. Around the stretcher, the staff hesitated, hands hovering over instruments and tubing. The canine barked again, short, sharp, almost angry, and stepped closer to the forestand, nose lifted toward the clear plastic bag hanging above Emily's arm. Ava didn't look at the dog this time. She was staring at the girl's skin. Stop it, she repeated quietly. Something in her voice made the nurse beside the stand reach up and clamp the four-line shut. The drip stopped instantly. Caldwell stepped forward. Nurse, you better have a reason. Ava leaned closer to Emily again, checking her pulse while studying the slight tremor running through the girl's fingers. The twitching wasn't random. It followed a rhythm Ava recognized too well. The kind of rhythm she had seen years ago under very different lights in a place where desert dust stuck to sweat and helicopters circled overhead. Her voice stayed calm. This isn't cardiac, she said. Caldwell frowned. We already discussed that possibility. Ava shook her head slightly. No, she said quietly. This is exposure. The word landed heavily in the room. A Marine medic near the doorway stiffened immediately. Exposure to what? Ava didn't answer right away. Instead, she lifted Emily's wrist and checked the skin along her forearm. A faint redness was spreading outward from where the four had been inserted, far faster than normal irritation would allow. Behind her, Titan gave a low growl. Not aggressive warning. Ava glanced toward the dog briefly. Chemical, she said finally. The room went silent again. Caldwell blinked. "You're suggesting a toxin." Ava nodded slightly. "Possibly nerve agent contamination." A nurse inhaled sharply. Someone whispered, "On a military base." The thought alone was enough to make several people glance instinctively toward the doors. The ER suddenly felt smaller, the air heavier. Outside, the faint chop of helicopter blades echoed somewhere over the base. Caldwell crossed his arms slowly, trying to stay grounded in evidence instead of speculation. "That's a serious claim, nurse." "I know," Ava replied. "Do you have proof?" Ava gestured toward the K9. "Ask him." Several heads turned toward Titan again. The dog was now standing directly beside the forestand, nose almost touching the plastic bag. He barked once more and then looked back toward Ava like he expected her to understand. And she did. "The dog wasn't blocking us earlier," she said quietly. "He was blocking contact." Caldwell's expression tightened as the idea formed in his mind. "You think the contamination was on her?" Ava nodded. "Or on something touching her." She reached for the forebag carefully without opening the line again, examining it under the bright trauma lights. The fluid inside looked perfectly normal, but that didn't mean much. In Afghanistan, Ava had seen nerve agents so diluted they looked like ordinary water until they started shutting down the nervous system of the people exposed. Her memory flickered briefly to a dusty road outside Helmand Province. A young Marine lying on a stretcher. A military dog barking at a medical pack no one else suspected. Ava forced the memory away and looked back at the bag. "We need decontamination protocol," she said. One of the nurses looked shocked. "Here in the ER?" "Yes." Caldwell rubbed his jaw slowly. "You're asking me to initiate a chemical response based on a dog and a guess." Ava met his eyes. "It's not a guess. What makes you so sure?" She hesitated for the first time since the girl arrived. Then she said the one sentence that changed the room. "I treated the same agent in Afghanistan." The Marine medic near the door straightened immediately. "You were deployed." Ava didn't answer. Caldwell studied her face carefully now, noticing details he hadn't thought important before. The steady posture, the calm voice under pressure, the way